Good afternoon, Miss. I'm Pinky Sabatin, student nurse of Mate Doctor College. Today, I will demonstrate the oxygen administration. But before that, I will show you my surrounding to ensure that I didn't shake. I want to remind you that all my equipment is improvised only, as well as my uniform. So this is my oxygen tank. This is a water, soft drinks bottle, and pictures only. So next is we will proceed to the procedure. So first is assess the patient's respiratory rate and level of consciousness. Mayang buntag, sir.
Good morning po.
Then next is determine the current arterial blood gas if available. Then next is post no smoking on the patient's door and view of the patients and visitors. Next is show the cannula to the patient and explain the procedure. Good morning, sir. Ako di IC Pinky Sabatin, student nurse sa Mate Doctor College. Nakadalis karon, sir, para maghatag sa imong oxygen. So, mao na itong missile cannula. Mo na siyang ginakonect dito sa atong oxygen tank. And then, naimagawas ng oxygen na and then ginabutan natin na siya ng ilang para ma-improve ang iyong paghinga. Okay lang ba na, sir? Then next is make sure that the humidifier is filled with appropriate mark. Next is check the oxygen tank by turning on the regulator gauge to determine the amount of the oxygen on it. Next is attach the connecting tubing to the cannula to the humidifier outlet. Then next is set the flow as prescribed liter per minute. Fill to determine the if the oxygen flowing in the tip of the cannula. Then next is place the tip of the cannula to the patient's nose and fasten tubing on around the patient's head or behind the ears. Hello, sir. Ako nang ibutang ning kaning nasal cannula sa ilong and ibutang po na ako ni sa behind sa mong ear. Okay lang ba ni sir? Ako nang i-answer no, butang. Okay.
Baka sumunod pa.
Okay na.
Ay, kung ano. Kung ano, bisunod pa. Binagkiling bisunod pa sa ulo. Kaya nga.
Next is adjust the flow as prescribed and encourage the patients to breathe in through the nose with mouth closed. Sir, kanang pag maghinga ka sir, gamiton nimo imong ilong and then i-close nimo imong mouth. Pwede ba nimo i-sir, ipakita sa ako Then next is determine the patient's comfort with oxygen use. Sir, okay na ba ang flow sa ato ang oxygen sa naligaw sa ato ang kanila?
Yes, mapapala na.
Sige, mag-ingon lang ka sir kung naa kay mga na-feel nga mga irritable sa imong ilong.
Yes, ma'am.
Then next is note the flow rate used and patient's response. So this is the end of my presentation. Thank you.